Mr. Speaker.
Order. Questions for oral answer. Ms. Fumiha.
Mr. Speaker, may I address questions 1 through to 9 from
Yes,
the
please.
order paper, please? Sir, we would like to thank everyone for their support for our vaccination program. We will continue our efforts to encourage the take-up of the vaccine. Vaccination is free for all Singaporeans and long-term residents. We have expanded the number of vaccination centers to 31 today, and there will be a total of 40 vaccination centers island-wide by mid-April, so that individuals can be conveniently vaccinated near their home or their place of work. Our supply of vaccines remains limited by the availability of vaccine manufacturers to deliver, given the high levels of global demand. This has resulted in limited booking slots in recent days. I apologize for the inconvenience caused to those who have not been able to book earlier. As more supplies arrive, we will progressively open more slots. We have had to prioritize our vaccinations, starting with our healthcare workers, the vulnerable elderly, and those involved in COVID-19 operations. The Expert Committee on COVID-19 Vaccinations had also recommended that we prioritize those personnel whose job roles are of critical importance to the functioning of Singapore and are at higher risk of exposure to and onward transmission of COVID-19. This is critical to ensure that key sectors would be able to continue functioning effectively, even during a local outbreak, and further reduce risks to our vulnerable population and the community at large. Such personnel include those involved in safeguarding our borders, maintaining law and order, those involved in the provision of utilities such as water, energy, telecommunication services, workers who ensure the supply of essential food items, and land transport workers involved in ensuring that our transport services are kept running. Religious workers might also face potential risks as they may engage in regular and non-transient contact with worshippers and devotees, including the elderly and vulnerable. Older religious workers, aged 45 and above, are already eligible for vaccination. Religious workers are also required to comply with safe management measures in the conduct of religious services and in other engagements with worshippers or devotees. We continue to make steady progress with our vaccination program. As of the 3rd of April 2021, around 1.52 million COVID-19 vaccine doses have been administered. Around 1.05 million individuals have received at least one dose of the vaccine, of which more than 468,000 individuals have received their second dose and completed the full vaccination regimen. To date, about 60% of eligible seniors aged 70 and above, and close to 70% of eligible seniors aged 60 to 69, have received the COVID-19 vaccination or booked their vaccination appointments. We have recently invited citizens and residents aged 45 to 59 to begin to register for their vaccinations, and close to 500,000, or about half, have done so. We're encouraged by this strong response. Those who have registered will progressively receive invitations through SMS to make their appointments for their vaccination. This may take some time given the number of people who have registered. To date, about 17% of eligible individuals have received the vaccination or booked their appointments, and we expect the rest should receive the SMS by the middle of May, and they can expect a booking slot by early June. We thanked everybody for their patience. People under the age of 45 have also been patiently waiting for their turn. Based on the current schedule, we plan to begin inviting them in June to book their slots. If all goes well, we will complete the vaccination program as scheduled by the end of the year. Some members of public may wish to receive the vaccination early for a variety of reasons. Since the 16th of March, we have opened up an appeals channel for Singapore citizens and permanent residents who need to travel overseas on compassionate grounds for employment or study purposes. Applicants will need to meet certain criteria. These are listed on the website, www.vaccine.gov.sg/appeal. And they will need to submit sufficient documentation to support their appeal. We will prioritize appeals with earlier travel dates if they are able to complete the 2-dose regimen prior to departure. Close to 98% of those who booked appointments for COVID-19 vaccinations in the last 30 days have showed up for these appointments. We estimate that about 1% of those who turn up were rejected because of concerns about allergies and contraindications. We encourage everyone to be vaccinated when your turn comes and to turn up at the vaccination appointments that you have made so that you do not deny another person the opportunity. However, such cases do not result in vaccine wastage. We closely monitor the vaccine appointment bookings and the historical take-up rate, and we deliver the appropriate number of vaccine doses to the vaccination sites. Unopened vials can be stored at the vaccination sites for at least 3 days. Vaccination site providers will start a new vial only when they have checked that there are individuals awaiting vaccination to avoid vaccine wastage. And at the end of the day, to utilize any balance remaining in a multi-dose vial and further minimize wastage, there are pre-planned lists of individuals who will be invited to be vaccinated. These could be staff who are working at the vaccination sites or frontline volunteers who have an active role in engaging seniors on vaccinations. As with other established vaccines, people who receive the COVID-19 vaccine may experience common side effects, such as pain at the injection site and fatigue. Should these side effects persist or get worse after a few days, they should see a doctor and seek medical attention. In very rare cases, the COVID-19 vaccine can cause a severe allergic reaction, such as difficulty breathing, swelling of face, throat, eyes, or lips, a fast heartbeat, dizziness and weakness, or a bad rash all over one's body. In the event of a severe allergic reaction, please call 995 or visit the nearest hospital immediately. Members of the public can also visit the website, www.vaccine.gov.sg, or the MOH website to further understand post-vaccination symptoms. MOH will be conducting further studies to monitor and review the extent and duration of immunity provided by the COVID-19 vaccines. This includes collecting selected post-vaccination samples from groups such as healthcare workers, frontline staff, and seniors to monitor the persistence of antibodies up to 24 months. Currently, in line with international practices, there are no plans to test the serology of everyone who is vaccinated in Singapore. We will share more details about the studies once they are completed. Vaccination is a key enabler to reduce the risk of community transmission and allow more economic and community activities to resume. As more vaccine stocks arrive, we will continue to expand our vaccination program to more segments of the population, so that all Singaporeans and long-term residents in Singapore will have the chance to be vaccinated by end 2021. Thank you, sir.
Ms. Fumiha.
Thank you, Speaker. I would like to ask the SMS for health two supplementary questions. The first is, I think SMS did explain about the the measures taken to minimize wastage, but I would nevertheless like to ask whether a standby system can be arranged to allow those who are not yet eligible for vaccination but willing to wait on standby basis at vaccination centers to take the place of those who did not turn up, assuming, the frontline people who are volunteers has already had their turn. So whether a standby system can be arranged for those who's willing to wait, given that it probably take the rest of the year for the rest of the population to get their jab. So that's the first question. The second relates to prioritizing vaccination candidates. Would most staff and volunteers involved in additional night prayers during the holy month of Ramadan be considered to be at increased risk of infection, given that they're expected to serve at least 250 congregants a day? So if SMS can respond to that, thanks.
Mr. Speaker, I thank the member for the suggestion of a standby system. We will continue to study how best to deal with the challenges of prioritizing those most at risk, those who have some urgent need, and having some equitable distribution across our population, even as we try to cover as many people as possible before the end of the year. But we will study her suggestion. The point that she makes about the prioritization for workers in certain religious settings highlights the need for continued safe management measures and vigilance from everybody involved. But if there are specific individuals who might have particularly high risk, we will look at their situation and try our best to accommodate.
Ms. Sylvia Lim.
Thank you, Speaker. I have two sets of clarifications for the Senior Minister of State. Could he, first of all, confirm that there's actually been a change in the advice given to certain groups of people who were initially considered to be ineligible or asked to defer their vaccinations? By that I mean, I think in the initial phases of the online screening, people were asked whether they had allergies and whether they suffer from certain conditions, but I think there's now new advice given that these people who were originally considered not eligible actually can take the vaccination. So I'd like him to confirm that there has been actually an update or a change in those instructions. And in that light, first, has the online screening been modified so that we do not exclude people who can actually take the vaccination? And secondly, are we catching up on those who were deemed to have failed the online screening initially, but now with further scientific evidence they're actually eligible to take the vaccination? How are we catching up with those people?
Ms. Lim is correct. Indeed, the advice has shifted, that it is severe anaphylactic reactions that we are most concerned about. And as an increasing number of people have been vaccinated, we have confidence over the situations in which someone previously thought to be ineligible might now go forward and have the vaccine. Indeed, the online systems and our various guidance to people manning counters and hotlines have changed. And the way in which we're catching up is that the citizens involved remain as part of our patients, the patients of the healthcare providers. The vaccine system will continue to track this process. Most people are able to go forward and complete the vaccination. Indeed, if there are individuals who have been deemed ineligible, I would reinforce that this is about deferring the appointment and the consultation to a time where perhaps they might subsequently become eligible, and we will continue to pay close attention to this segment of the population. Thank you.
Mr. Murali Pillai.
Mr. Speaker, sir, I thank the Honourable Senior Minister of State for his answer to my parliamentary question. I understand that he mentioned that the government does not intend to measure the antibody levels of persons as it stands now. May I please ask the reasons for this? Given that, at least among some quarters, the understanding is that the vaccination may kind of effect of or rather the effectiveness of the vaccination may peter out after several months. And also, wouldn't there be a need to guard against variants, and in particular, the effect of this vaccination against variants? Thank you.
Mr. Speaker, I thank the member for his question. As I mentioned, we are studying the matter of antibody levels. And I think before we make a decision about how we would look at what's happening in the population, let us first do those studies. For most vaccinations previously, that hasn't been the approach to go with a population-wide antibody assay. It's also logistically very difficult and would place a burden on our population. So we need to be sure that it's useful and necessary before we would do such a thing. However, with the issue of variants, assaying a set of antibodies to a prior vaccination isn't going to necessarily be useful to inform the clinical risk for a new variant that perhaps wasn't there when that vaccination was delivered. So I think there are two separate issues. The issue of variants, virus variants, I beg your pardon, is being closely studied by our experts as well as international experts. And the matter of if, when, and whether we should be doing serology and antibody testing is also being studied. So let us complete those studies before we make any decision on that basis.
Associate Professor James Lim.
Thank you, Mr. Speaker. Two quick questions for the SMS. Given the diversity of vaccines that will eventually be deployed, I'm wondering if there has been any effort by the government in persuading take-up based on specific types of vaccines. I'm thinking in particular that certain of my elderly residents may have a preference, for instance, for the Sinovac versus the mRNA vaccines. And related to this, the second question is whether the ministry will actually have a threshold target for coverage associated with herd immunity, and if so, what would the next phase of relaxation of control measures look like were we to attain that threshold?
Mr. Speaker, I thank the member for the questions. The take-up rate is healthy across the vaccines that have been licensed and are being used in our various centers. Sinovac hasn't been licensed yet, so it's a bit premature to talk about that at this point in time. The target is for as many of our eligible residents to be vaccinated. Herd immunity indeed is useful, but you can also imagine that we would perhaps want to make sure that individuals who want to travel overseas would also continue to be protected, and that requires them to be vaccinated because once they're overseas, they will not benefit from herd immunity here in Singapore. So let's get that number as high as possible, and we hope to be able to offer the vaccination to all eligible Singaporeans and long-term residents by the end of 2021. It's a little bit premature to be then talking about the relaxation measures for the next phase when we haven't reached it.
Abdul Samad.
Mr. Speaker, sir, I thank the SMS for the earlier explanation. I just want to check out for the essential services workers, right? Because since when I submitted the PQ, thereafter came the announcement that those who want to vaccinate under a certain age group, but they are workers in the essential service group. How do we then ensure they are all vaccinated for the second dose in the appropriate time? The risk is because we tend to mix with migrant workers a lot, and we also do a lot of engagement. The Earlier, as far as I'm concerned, the first group of essential group are those who are working during the circuit breaker period. After that, all is not being given priority to go for the vaccination. Hopefully, MOH can review this part.
Mr. Speaker, I thank the member for his concern. We are indeed tracking the completion of vaccinations among the essential workers closely, and we do so through the employers as well as some of the regulatory bodies for the relevant domain. We could not wait to complete every single essential worker before we then started with the elderly or the vulnerable or other at-risk groups. And so we have parallel processing, if you like, that essential workers continue to be vaccinated, although most of them have largely been done so, together with the rollout to the elderly. And just as now not all the elderly are vaccinated, we've started with the next group, and we will in parallel open up to more and more segments of our population as our vaccine supplies come in. But we will continue to pay close attention to make sure that those who are vulnerable or who are at high risk or who perform these essential functions will get priority.
Mr. Lim Biao Chuan.
So I have quite a large number of residents who wanted to travel for various reasons and we made various appeals. Now some of them may be for studies and some of them may be for other purposes like look after nephews, to attend weddings. Now for some reason MOH has applied quite a strict criteria to those who have made the appeals. I'm asking MOH whether they will consider being more flexible about allowing people to travel overseas, to get their vaccination earlier before they travel overseas, as contrasts to extending the vaccination program to residents of a different age when they can be actually quite neutral about taking their vaccination earlier or later. So we have one group who wants it earlier versus another groups who are actually very neutral about whether they get their vaccination earlier. So could MH be a bit more flexible to allow those who want to get their vaccination earlier, get it earlier? Thank you.
Mr. Speaker, I thank the member for the question. The issue is the limit of our vaccine supplies, and that even though there may be some people who are a little bit agnostic about exactly when they get it and are willing to defer, the reality is that we are vaccinating people as quickly as possible given the supplies that come in. And so if we were to prioritize one group or the other, it will be at the expense of another who currently wish to be vaccinated. The slots are booked. And the capacity is being used up and the vaccines are being used up. So we recognize that there are people who wish to be prioritized. We do have an appeals channel. We will try our best. There are criteria, and it is very helpful if documentation is submitted to support that criteria, and we will work our way through these appeals to try to help as many people to be vaccinated as soon as possible. But ultimately, the limit is not our wish to force people who perhaps a little bit hesitant at this point. We do encourage everybody to do it. The limit is actually the rate at which the supplies are coming in.
Ms. Joan Pereira.
Thanks, Speaker. SMS, I have an SQ. A few elderly residents told me they felt pain in their legs and their knees the day after vaccination, and one even showed me a rash at the vaccination area. So they worry and they wonder if it was caused by the vaccination or would it go away or they needed to seek treatment. So I would like to propose if MOH would consider having a hotline manned by a multilingual team who can speak the mother tongue and dialects. It will be helpful to assure them. Thank you.
Speaker, the member for her question. There are 2 points which are slightly separate. One is the importance of making sure that we make our materials, our transactions, and our interactions available in multiple languages. And indeed, we will pay quite a lot of attention to this, especially on the ground, at the counter services, at the vaccination centers. The separate issue is residents who then experience symptoms after having had a vaccination. And what she is describing is a situation where one has clinical symptoms a day after vaccination, and you're worried about whether these are a problem, whether you need medical help. I would suggest that perhaps an MOH hotline manned by our non-clinical staff may not be the best first port of call for residents in such a situation. And if they have clinical symptoms, if they have persistent pain, persistent fever, rash, especially things like difficulty breathing, what they need is to seek clinical help, and they should do so from the relevant hospital, polyclinic, and clinical care providers that are close to them.